I'm Dr. Weyrich, and here in the studio today I have a couple of my patients that have been fairly long-term patients for me working on their thyroid. And so would you care to introduce yourself?
Hi, my name is Carla, and I'm 65 years old. I have been a patient of Dr. Weyrich since around 2018. I've had a long history of thyroid issues stemming, I believe, from Lyme disease. I've been diagnosed with Hashimoto's thyroid, and I'm a non-converter from T4 to T3.
Okay, so let's talk more about what that means, because that's the kind of thing that not everybody quite understands when dealing with the thyroid. So that's a very important point, that you've got some special medical features that need to be taken into consideration when doing your treatment for thyroid. And our other guest here?
I'm married and I'm 86 years old, and I've been a patient of Dr. Weyrich since 2018, and I do not have a thyroid. It was removed in the early 80s. I've had continuous problems with it until I looked upon Dr. Weyrich. That's been the only solution, his medication and care.
Well, I appreciate that. A person that doesn't have a thyroid gland is a special case that has to be managed more carefully than most patients, because it's just like if you're diabetic and your pancreas doesn't work, when it's really hard to keep your body in balance with the blood sugar. Same way, if you don't have a thyroid gland, it's a lot harder to keep things in balance. But with careful planning and measurement and so forth, we can do a pretty good job, I think.
I'm usually healthy and active, and that's diminished a little bit because of the weather. And I think my thyroid is good, and we're going to test more for it.
Yes. Again, if you don't have a thyroid gland, then it's a little bit more difficult to manage, and we have to be a little bit more careful about the testing and so forth. But it's also important to actually talk to the patient and find out how they're feeling, because the lab tests don't really give the whole picture. You have to treat the whole patient.
That's right.
So, Carla, we were talking with you about the fact that you're a poor converter. And so basically what that means is you're familiar with the general way that the thyroid works. So the hypothalamus and the pituitary are the control center of the body, and they receive inputs of all kinds of status from the body, and they decide how much energy you need. So the thyroid is the gland that is most important for regulating energy levels in the body. I like to compare it to a thermostat. So if you have a furnace in your house, it doesn't just have an off-on switch. It has a thermostat that you can set to a particular point. You say, I want my house to be 75 degrees. Mm-hmm. And it gets inputs from either just where it is in the house or a fancy thermostat. It senses all over the house and takes an average or something. And that's what your hypothalamus and pituitary are doing, sampling what's going on throughout the body. But then it comes to the decision how much energy. And so the pituitary gland, long story short, produces a hormone called thyroid stimulating hormone, or TSH. And that flows through the blood from your brain down to your thyroid, which is located at the bottom of your throat in the front. And the thyroid gets stimulated by the thyroid stimulating hormone, and it makes another hormone that's called T4. And it's a thyroid hormone that has 4 iodines on it. That's why it's T4, 4 iodines. Iodine is very important. So after we have the thyroid gland making the T4, the brain, hypothalamus and pituitary, see the T4 in the blood, and that's part of what they use to decide how much more thyroid stimulating hormone it needs to make. And that's called a feedback loop. But T4 itself is inactive. It goes to other parts of the body, in particular the liver, but many other tissues are also able to convert T4 into T3. Now, T3 is the active hormone that goes to all the cells in your body, and one of the most important things that T3 does is it stimulates our mitochondria. Now, the mitochondria actually are the energy powerhouses of all our cells. And so the body senses what the mitochondria are doing, hypothalamus see what the mitochondria are doing, and it decides, do we need more thyroid hormone? If so, make more TSH. Do we need less thyroid hormone? We've got too much energy. make less TSH.
Right.
Or if your brain notices that you're on a starvation diet, either because you're trying to lose weight or because you're truly starving, your brain will say, better turn down the thermostat to save energy. And so your thyroid will get turned down by getting less thyroid stimulating hormone. So that's how the system works. And to fully understand how the system is working, I have to measure a number of different hormones because there's different moving parts and they're all working together. So I measure the TSH, and TSH is what most doctors look at first, and many doctors stop after looking at the TSH. Mm-hmm. So the TSH tells any doctor what the brain is thinking about the energy status. Does the brain want more energy or does the brain want less energy? But that's just first step of the puzzle. The TSH then goes to the thyroid, and the thyroid makes primarily T4. So, is the thyroid doing its job right, or is the thyroid gland sick? For example, with Hashimoto's, thyroid gland doesn't work properly and can't make enough of the T4. How do we know that if we don't look to see what the T4 is? Okay, so now if everything is working well, we've got all the T4 we need, then goes to the liver and other tissues, gets changed into T3. Did the liver do its job? Don't know unless we look.
Right.
And then the tissues that convert T4 to T3 actually can make either what's called reverse T3 or T3. T3 stimulates the mitochondria. Reverse T3 is like a brake that slows down the mitochondria. And the liver, based on hormone inputs that it's getting, decides how much T3 and how much reverse T3 you need. And so in some cases, I need to look at the reverse T3 as well. And looking at all of these, I get a really good picture of what's going on. And
clinical picture.
A clinical picture. Well, this is the numbers picture.
Right.
But then I have to say, okay, how are you feeling? Do you have symptoms of low thyroid or high thyroid? And if you're symptomatic, but the numbers look good, I need to dig deeper. Mm-hmm. So most primary care physicians don't go this far.
Neither do endocrinologists.
Well, some do, some don't, perhaps. But I'm not going to label anybody. But I'm not an endocrinologist, but I've studied endocrinology a lot. And in particular, I'm very interested in the thyroid. But there's different points of view. And when you are working with a doctor who takes Medicare or other insurance, the insurance company has an idea about how much testing is enough testing. Guidelines. And the insurance company starts raising their eyebrow if the doctor starts ordering too many thyroid tests. Because each thyroid test, I don't know what it costs the insurance company, but it pay cash around $30 per test. And I've talked about I wanted 3 or 4 tests maybe for a workup of a thyroid patient. So it adds up. And so since I'm a naturopath and insurance won't pay for anything I do, I say, okay, I can do what I want. The insurance company is going to tell me I can't, but I've got to get permission from the patient to spend the money because ultimately the patient has to pay for it. Insurance won't pay for me to order this kind of testing. So that's the good and the bad. But young ladies both are doing well, and I think you've told me stories about trying other doctors that weren't quite as understanding, and I'm not going to beat them up or anything.
No.
They have their constraints that they have to work under, but that's what I do.
Well, something that I found that was very pleasing about you is that you listen and you care. And finding that combination in a doctor is
rare.
It's very rare, and it's just you care and you're super, super knowledgeable. So you've taken me when I've come in and said, okay, I've had Lyme disease. I've had dysregulation of my hypothalamus and pituitary axis. I've got a stealth bacterium that's lived in my body that my body can't find, and it's turned on itself and gone autoimmune. There's all kinds of problems. The teeth, the neurotoxins are more attractive to the thyroid receptor sites. And the more your body is full of neurotoxins, they'll block the receptor sites a lot of times. Right. So, I mean, I've gone through a lot of doctors. Just years of trying to find someone. I've walked around with a goiter. I've walked around with hair falling out, being cold, dry skin, just all of the clinical picture that having doctors refuse to treat because my TSH was okay.
Yes, and that's sort of a bone of contention between naturopaths and the medical establishment. So in medicine, the question arises, do you have a problem or don't you have a problem? And we have the idea of what's called a reference range, which is two numbers for a lab test. If your value for TSH or whatever is too low, then you get a diagnosis. If it's too high, you get a diagnosis code. If you're in between, you're fine.
And it doesn't matter clinically how you look or feel,
Yeah.
you're still fine.
Well, at least there's no problem with your thyroid. And the way the reference ranges are constructed, if they look at 1,000, quote, healthy adults, and they see that the range of the middle 95% is whatever, then that defines what's okay. And it's only the 2.5% that are too low and the 2.5% that are too high that define what is a problem. But most naturopaths feel that that range is too broad, and if you're low normal and you're complaining, we should do something for you.
Right.
Or high normal. And the other problem with, especially with the primary care providers, is insurance company discourages looking beyond the TSH. And so
And therein
miss a
lies the
lot.
problem.
Yeah.
And it was a blessing for me and my mother to find you. I mean, actually, you've been a blessing to us.
I appreciate that.
Yeah, he's been a phenomenal blessing.
It took maybe a year, and then I began to understand what you were all about and how you could possibly help me. I had Lyme disease too,
Mm-hmm.
and it destroyed my heart or my valve, whatever,
Mm-hmm.
and causing me to have all the heart surgeries. But it destroyed a lot of stuff.
That was all before I met you, though.
Oh, yeah, years before. I'm so glad that we started with you and you will be able to talk to us finally, speak openly and without restraints and everything.
But I do very well, personally, I think, on a one-on-one basis.
You do.
And I do pretty well standing up in front of a crowd teaching. I tend to use my teaching voice too loud sometimes when I'm one-on-one, get into the teacher mode. I apologize for that.
No, it's good. It's all good.
All good.
And like I said, we've had complicated medical problems. Complicated. That it takes someone that's willing to delve in and just
listen.
And listen and then put your brain behind it, and that's what you've done, and that's you can't imagine how much you've helped us. I mean,
Okay, well, I appreciate that.
We're very protective of you, and yeah, we are.
Okay, thank you for coming in and sharing with our listening audience. I've got another patient waiting to be treated, so
I would highly recommend you to anyone. Absolutely.
She has, and me too.
Okay. Well, thank you for that.
All right, you're welcome.
And you all have a great day, and if all goes well, I'll see you again in about 3 months when you're due for your next checkup.
And keep up the dialogue.
Oh, yes.
That's so important.
Yes, and you have your homework. I'm known for giving my patients homework.
Yes.
And as soon as I get the information I want, I will be making additional actions on your behalf.
Well, you're available readily by the phone or through email or something. I appreciate that. Other doctors aren't that way.
Yes,
And
and
I appreciate that about you.
Great. And for the record, my direct phone number with answering service is 888-391-0414. And I have a website, which is drweyrich.com. That's it. Type it into the address bar, not the search area, but the address bar of your browser. And I'll pop right up.
Lots of information there.
Okay, and more coming. What you see in public is just a small fraction of what I have behind the firewall that I haven't organized for public display yet.
All right. Do we know what kind of test you want us to have?
I think I know what tests I'm going to order for you, but I wanted to get some information, your homework, before I decide for sure how I want to do the test. I don't do things by the book so much. I read the book, but then I pick and choose the pages that seem most appropriate. So you don't normally come in to see me and walk out with a script after 5 minutes of talking to me. Well, thank you again for coming in.
Thank you. We appreciate you.